The tinnitus has become one of the most challenging tasks faced by the medical field because it has got a medium to severe negative impact on the quality of life of the patient. In an earlier class, I have discussed everything about tinnitus, starting from the causes of tinnitus to the management. But there are so many recent advances coming in tinnitus therapy. So in the next few minutes, I will describe the recent advances in the treatment of tinnitus. Okay. So the first and foremost one is the pharmacological treatment, that is by prescription of drugs. In that case, we can divide tinnitus into acute causes and acute tinnitus and chronic tinnitus. Acute tinnitus means the duration is less than 3 months. And if it is more than 3 months, we can take it as chronic tinnitus. The acute tinnitus, the identification of the cause and the proper treatment is very important because there is only a reversible cochlear damage in case of acute tinnitus. So that can be reversed completely. Okay. So that is why the identification of the etiology and the correct treatment is very important, especially in the case of an acute tinnitus. So, what are the drugs given in case of acute tinnitus? The first one is corticosteroids, you all know. And as in a case of sudden sensory neural hearing loss, we have to give high dose of corticosteroids up to 1 milligram per kilogram body weight for the first 3 days. Then it is tapered over a period of 10 days, minimum of 10 days. And if the patient cannot tolerate systemic corticosteroids, then we have to give intratympanic injection of steroids. Intratympanic steroids are injected, but that has to be done. If there is bilateral tinnitus, at a time only 1 ear has to be injected with the intratympanic steroids. Okay. Intratympanic steroids will reduce the systemic side effects of corticosteroids, but and also the perilymphatic concentration of steroids will be more in case of intratympanic injection than in a systemic corticosteroid therapy. But there is more chance of, in ITS there is more chance of an tympanic membrane perforation, then otitis media, pain, hearing loss and also transient attack of dizziness. Okay, so these two are the first line of treatment in case of acute tinnitus. And next line is the hemorrheological agents. Hemorrheological agents like dextran, 6% hestril and also pentoxifillin, they will lower the plasma as well as the blood viscosity and also reduce the aggregability of erythrocytes and thrombocytes, so that the circulation to cochlea as well as the central auditory pathways increase. That is, they will improve the microcirculation and also the supply of oxygen and nutrients are increased to that area and also aid in tissue regeneration. So that is why these hemorrheological agents are advised in case of an acute tinnitus. And neotropics, what are they? Neotropics are a group of drugs which will improve a variety of cognitive functions such as learning and memory. So one example of a neurotropic is piracetam. And this piracetam is a derivative of, it's a cyclic derivative of gamma aminobutyric acid. So piracetam is a cyclic derivative of GABA. It increases the cognitive function. That is, it influences the neuronal and the vascular function and improves memory and cognitive effects without causing sedation or stimulation. And this has also got an anti-hypoxic effect. So it increases the cognitive function and also it got an anti-hypoxic effect, and this has to be given for a period of 4 to 6 weeks. And this can be given in both acute tinnitus and also in chronic tinnitus, and piracetam is also advised in treatment of sudden sensory neural hearing loss for a period of 4 to 6 weeks. The local anesthetic drugs, lidocaine is the most recommended one. It is not given orally, but it has to be given in either intravenous or intradermal lidocaine in very high doses. Also, intratympanic injection of lidocaine is also recommended, but there is very high chance of nausea and giddiness after giving an intratympanic injection of lignocaine. It causes vasodilatation, antithrombotic effect and anti-inflammatory effect. You know, the basic cause of tinnitus is found to be reduced blood supply to the areas of cochlea and also to the auditory pathway, central nervous system auditory pathway. So this lidocaine will increase the blood supply to that area. It has got an antithrombotic effect. So the intravenous or intradermal high dose of lidocaine is advocated. And coronary drugs are advocated only, they are seen only in evidence. There are so many trials going on. Coronary drugs like tocainide. The effect is not that much proved. It is only so many trials are going on this anti-arrhythmic drugs, but the effect of lidocaine is very much proved and it is highly recommended for the treatment of acute tinnitus. Also, there are other drugs like beta-histine, because oral beta-histine is an histamine precursor. It increases the perfusion of stria vascularis. Basically, it increases the blood flow to the cochlea by increasing the perfusion of stria vascularis, so that it is also used in Meniere's disease, and this beta-histine can also be used in acute tinnitus. Ginkgo biloba is another one, ginkgo biloba for minimum period of 4 to 6 weeks, and also other antioxidants like vitamin C, vitamin E, coenzyme Q10, vitamin E, coenzyme Q10 and beta carotenes can also be given, as it has got an antioxidant property. So all these corticosteroids, hemorrhagical agent, nootropics, local anesthetics and beta-histine, ginkgo biloba and antioxidants are given in the treatment of acute tinnitus. Drugs used in chronic tinnitus. Chronic tinnitus means tinnitus lasting for more than 6 months. So less than 3 months is acute tinnitus, 3 to 6 months there is a subacute variety, and more than 6 months it is chronic tinnitus. So in chronic tinnitus, the first line we use is antidepressants, because this abnormal functioning of the auditory as well as non-auditory areas, and these non-auditory areas include the limbic system, prefrontal cortex, amygdala, etc. And the negative emotions such as depression, anxiety, etc. are under the control of limbic system. So when this limbic system is activated, there is increased association with the tinnitus. So antidepressants, mainly tricyclic antidepressants like amitriptyline, imipramine, and also serotonin uptake inhibitors such as sertraline and fluoxetine are given in case of chronic tinnitus. And the second is anticonvulsants. There is increased firing of neurons in auditory as well as non-auditory areas of the cortex, which is associated with the tinnitus. Okay, so there is in case of tinnitus there is excessive firing of neurons in the cortical and non-cortical areas. So these anticonvulsants will act by blocking the sodium channel or by increasing the GABA function. This gamma aminobutyric acid is an inhibitory neurotransmitter. So when the function of GABA is increased, it will reduce or inhibit the firing of these neurons. That is the mechanism of action of anticonvulsants. So we can give carbamazepine or benzodiazepine or gabapentin can be given in case of chronic tinnitus. Okay, so that is anticonvulsants. And next is antiglutamic. And you know, this glutamate, this is an excitatory neurotransmitter which is found in cochlea and also in central auditory pathway. And the main named glutamate receptors in the cochlea and auditory pathway are mainly two types, AMPA and NMDA. Okay, so this release of glutamate will cause excessive firing of neurons, especially in the synaptic cleft between the inner hair cells and also the terminal fibers of auditory nerve. So between the synaptic cleft, this glutamate are released. If it is released in more in quantity, then there is a high chance of tinnitus. So our aim is to block these glutamate receptors, and there are non-selective glutamate receptor blockers, and there is also selective glutamate receptor blocker, and this acamprostate will mainly act on these three will mainly act on NMDA. They are selective glutamate receptor blockers. So caraverin is used in the treatment of chronic tinnitus, and also all these acamprostate, then fluopertin and memantine, they are selective glutamate receptor blockers, which is used in the treatment of, these are all in the treatment of chronic tinnitus. Other drugs like prostaglandin E1 analog, example misoprostol. Then calcium channel blocker like nimodipine. Loop diuretic like furosemide. Then there is also dopamine antagonist like dopamine antagonist. Example and also we can the vitamin supplement zinc, atorvastatin, etc. So usually a combination of all the above mentioned drugs, more than a single drug usage, a combination of multiple drugs depending upon the situation of the patient, whether it is acute tinnitus or chronic tinnitus, are given as a prescription of drugs in case of tinnitus. The second treatment of tinnitus is hyperbaric oxygen therapy, and that is 100% oxygen is given. The patient is seated in a chamber with a pressure of 1.5 to 3 atmospheres absolute, that is 80 is atmospheres absolute, and this is given for 60 to 120 minutes, 1 to 2 hours once or twice a day, that is one session, and 20 to 30 such therapy sessions are given to a patient. And what is the basis of this? We know that hypoxia is a cause of tinnitus, and this organ of Corti has no direct vascular supply, and the oxygen diffuses from the stria vascularis to perilymphatic and endolymphatic spaces of the organ of Corti, and from that organ of Corti get the adequate oxygen, and this oxygen is very important for the tissue, healing of tissue. Okay. And the partial pressure of oxygen of the inhaled air, it depends or it determines the pressure of oxygen in the blood. Okay, that you know. So, since hypoxia is found to be a cause for tinnitus, we are giving hyperbaric oxygen, especially in case of acute tinnitus. This is evidence shows more favorable for an acute tinnitus than of chronic tinnitus. Okay, so that is hyperbaric oxygen therapy. Sound therapy, that is we can use the tinnitus maskers, that is the sound generators, or we can use hearing aid, bar cochlear implant, and also tinnitus instrument. What is a tinnitus instrument? That is a combination of this sound generator plus hearing aid. These two in a combination is called tinnitus instrument. Okay. Sound generators are, if the patient is having tinnitus, we are giving a frequency of sound which is higher than the frequency of that tinnitus, so that the patient will not be distracted or will not hear the sound of tinnitus. Okay, they are sound generators, but it has got a disadvantage that when this sound generator is turned off, the frequency of noise or the sound of tinnitus can be enhanced, and also there is a chance of sound induced or noise induced sensory neural hearing loss. Okay, so you should be careful that the sound level of the sound generator should be just more than that the sound frequency of the pitch of the tinnitus. It should be just more than the pitch of the tinnitus, so that it will not cause much discomfort to the patient. And this is given when the hearing is normal. Patient is having tinnitus, but the hearing of the patient is normal. When there is hearing loss, we can give hearing aid, and if there is a profound hearing loss with tinnitus, we can do cochlear implant surgery. And these tinnitus instruments are used when the patient is having hearing loss along with a very high pitched tinnitus. In that cases, the hearing aid along with a built-in sound generator or noise generator is given, and it has got separate volume control for hearing aid and also for the noise generator. So in that case, that is the hearing loss along with a very high pitched tinnitus. In that case, this tinnitus instrument gives a very good performance or very good control of tinnitus, and the sound generator can be both narrowband or broadband noise can be given for masking. So this is regarding sound therapy or the hearing devices in case of, this can be used in both acute tinnitus and also in case of chronic tinnitus. The next advancement in treatment of tinnitus is tinnitus retraining therapy or TRT, and this is based upon the tinnitus model, that is neurophysiological tinnitus model, which tells that there is an abnormal neuronal activity from the periphery of the auditory system and also from the dorsal cochlear nucleus. And this abnormal neuronal activity is transmitted to the limbic system, and that is one of the pathogenesis of tinnitus. And when this abnormal neuronal activity is transmitted to the limbic system, that causes along with the perception of sound, there will be emotional upset, anxiety, depression, etc. to the patient, and that is the neurophysiological tinnitus model. So if your brain is considering this abnormal neuronal activity as an unimportant signal, then there will be an automatic habituation, and these signals from this periphery of the auditory system and from the dorsal cochlear nucleus will not be transmitted to the limbic system. So there will be an automatic habituation. Okay. So there will be an automatic habituation of your reaction and habituation of your perception. Okay, so the perception will be taken as unimportant, perception of the sound, and also there won't be, because it is not transmitted to the limbic system, the reaction like panic attack or anxiety or depression will not happen. So that is the basis of this tinnitus retraining therapy. We are giving counseling to the patient along with the sound therapy. Retraining means direct counseling of the patient as well as sound therapy, and this counseling to the patient is always on an individual basis, and the time everything is very flexible depending upon the patient characters, but the follow-up is important. Follow-up sessions are very important. The follow-up counseling for the first 3 months, it is given monthly, once in a month. Then after that at 6 months, then 9 months, then 12, 18 and 24 months. Okay, so the counseling at this period along with the sound therapy, that is tinnitus retraining therapy. Next is cognitive behavior therapy. In that case, we are not reducing the intensity of tinnitus, or we are not eliminating the tinnitus, but the patient behavior or adaptation to that is reduced. It consists of both cognitive restructuring and also behavior modification. As I already told you, some patients this tinnitus will lead to severe depression, anxiety, sleeplessness, then stress-induced problems, etc. So that is reduced by doing this psychoeducation, relaxation and stress management sessions, cognitive restructuring, attention control training, etc. and this is mainly useful in case of decompensated chronic tinnitus, and this is given usually for a period of 4 to 16 weeks, and that also is highly patient dependent. It is highly flexible and depend upon the individual patient needs, and that is this cognitive behavior therapy. The next one is biofeedback and neurofeedback. The biofeedback helps the patient to get moment to moment information as how the body responds to anxiety, stress or relaxation. In that case, we can use EMG sensor, that is electromyography sensor, so that in a situation of stress, whether the muscle tenses or not, like that. And then skin conductivity, that is using a very low electric current, the activity of the sweat glands are measured in relation to an autonomic upset or not. Then thermal biofeedback means the skin temperature is assessed when the patient gets to a situation of anxiety, stress or relaxation. And by all these methods, the patient will get how the body reacts, and the biofeedback or the control, self-control can be done. Such 8 to 15 sessions will be needed for the control of, especially for chronic tinnitus. And what is this neurofeedback? Actually, this neurofeedback is a type of biofeedback which is an EEG dependent biofeedback. So the patient will get the electrical activity that is happening in the brain. The electrodes are placed on the scalp, and the patient will get the neuronal activity of will get the brain wave, which represent a summed activity of the functions happening on the cortex. And this is a computer connected technology which helps the patient to self-regulate the abnormal brain activity at the time of stress, anxiety or relaxation. So that is also helpful for control of tinnitus. So excessive neuronal activity of the cortical and subcortical areas and also the prefrontal cortex is found to be one of the reasons for tinnitus. So if we modulate this electrical activity of the brain, which is called neuromodulation, that can inhibit or interfere or it can interrupt the tinnitus activity. Okay, so that is the basis of this magnetic and electrical brain stimulation, and of them the first one is transcranial magnetic stimulation of the brain. Transcranial magnetic stimulation of the brain. This uses an intermittent brief magnetic field that depolarizes the cortical neurons via an electromagnetic induction. So we are giving RTMS. What is that? It is a repetitive TMS of low frequency, that is around 1 Hertz. So low frequency repetitive transcranial magnetic stimulation is found to relieve chronic tinnitus to a greater extent. 10 to 15 sessions, daily sessions of this TMS, that is RTMS of low frequency, that is of up to 1 Hertz to the left temporoparatal area, is found to relieve chronic tinnitus for several months. Okay, so that is one thing. And the second is transcranial direct current stimulation. Transcranial direct current stimulation, that is we are applying an electrode over the specific area of interest over the scalp. So electrodes are applied to the skin of the scalp of specified areas, and to that we are giving low intensity current signals of around 0.5 to 2 milliampere, and that will inhibit it will interfere with the neuronal activity. So this is more safer than this TMS, and this will not induce noise, and also it is more well tolerated than the patient. But the usual side effects are headache, a minimal amount of dizziness, nausea, etc. And this TDCS are available as a portable units, but the treatment system has to be optimized, and also the protocols are yet to be developed. Okay. And the third thing is, third among the magnetic and electrical brain stimulation, transcutaneous electrical nerve stimulation. Okay. So transcutaneous electric nerve stimulation, and the electrodes are placed either to the temporomandibular joint or to the pinna or to the tragus or over the C2 nerve. Okay, and electrical stimulation is given so that the electrical activity is altered and there will be a suppression of tinnitus. And fourth is direct electrical cortical stimulation. So a direct electrical cortical stimulation by an implanted electrical array. So electrical arrays are implanted on the auditory cortex and that is directly stimulated. That is direct electrical cortical stimulation so that the tinnitus is relieved. The next one is acoustic coordinated reset neuromodulation. That is a type of neuromodulation in which we are giving an acoustic coordinated reset mechanism. The basic principle is that if a particular part of brain, in our case, a particular part of the acoustic cortex is deprived of sensory input, like in a case of hearing loss, that part of acoustic cortex is not getting any input, any acoustic input, that area will have an increased neuronal plasticity and also neural synchronization of that part of CNS, which will lead to a phantom auditory sensation which is perceived as tinnitus by the patient. It will be perceived as a subjective tinnitus. So in this case, we are aiming at desynchronization of that area. So in case of brain, if this area is the tinnitus generating area, we are giving 4 cycles of different tones. Okay, so tone 1, 2, 3 and 4 is given to this area and this is followed by a silent cycles. So there will be a random tone stimulus to this area followed by a silent cycle. So that will act as an on and off phenomena. So there will be, we are making a confusion of this area so that it will be presenting as a desynchronization of this neural input. Okay, so that in that way we can give relief of, especially in case of chronic tinnitus. 9th one is a music therapy. There are 2 types of music therapy that can be given, because we know that the music alleviates or improves or influences the brain function, especially the cognition, learning, emotion and perception. So one is a neuromusic therapy which depends upon the Heidelberger model of tinnitus, and the relaxing music is given to the patient, and also there will be a feedback mechanism by which the anxiety, stress etc. are alleviated. The second one is a tailor-made notched musical therapy or TMNMT. This is usually, this can be asked as short note for the residents. In that, the patients are allowed to hear the music of their choice, which is enjoyable to the patient, using a closed headband of comfortable loudness, but from the frequency band. 1 octave width frequency is removed, which is the frequency of the tinnitus, by using a digital notch filter, so that it's very enjoyable to the patient and it is of low cost also. But the importance is that the patient should know the exact frequency of the tinnitus. Then only this digital notch filter will remove that frequency band from the music energy width. Okay, so all these are the recent advances in tinnitus therapy.